All right, welcome back, everyone. My name is Shiva. I am a fourth-year medical student at Texas A&M College of Medicine and one of the officers for the Dermatology Interest Group. Welcome back to our podcast, the Residency Program Series podcast. And today we have Dr. Isabella Aldana. She is a PGY2 dermatology resident at the University of Alabama at Birmingham. Welcome, Isabella. Thanks for being on our podcast today.
Thanks so much for having me. I'm excited to be here, excited to share about all the good things we have going on at UAB.
Yay. Okay, so we'll just start off like we usually do. Tell us about yourself, kind of where you're from, the general course of events, undergrad, med school, if you did a research year, transitional, prelim year, all of that good stuff.
Perfect. So, like you already said, my name is Isabella Aldana. I am actually from Birmingham, Alabama. I grew up in one of the suburbs here. Did my undergraduate at Auburn University, which is about 2 hours south from Birmingham, one of the SEC schools. And then I actually returned to Birmingham for my medical training at UAB School of Medicine. I went straight through with my education, so then did my Brookwood Baptist transitional year for my intern year, and now back at UAB for my derm year. So excited to be now in my PGY2 year, now in my derm years, and officially a skin turn. So
Yay, it's very exciting after like over 12, 13, 14 years of work because you really start from high school for medicine. You finally made it to derm residency, which is exciting. Can you tell us a little bit about your personal interests in dermatology and outside of dermatology, kind of who you are as a person in and out of the clinic?
yeah. So within dermatology, I do really love general dermatology. I love the bread and butter. But I also really like skin of color as well as hair disorders and procedural dermatology outside of the clinic. I love to travel, always am looking forward to my next big trip. I like hosting friends over. I like to do some watercolor painting. And then I like to be outside too, like playing pickleball or tennis. And so those are a few things you can find me doing in my spare time.
Fun. Okay. Well, let's get into the program. Tell us about UAB, where it is. I'm assuming they have something in Birmingham, but any other locations that they have, the clinical sites, number of residents, number of faculty, just the bread and butter that we need to know.
Yes. So, like you mentioned, so we're the University of Alabama at Birmingham. So, to no surprise, we're located in Birmingham, Alabama. We are right downtown. Our main clinical site is here, as well as the majority of the other sites that we work at are all pretty much in walking distance. We currently have 17 residents. We have five in our PGY4 class, and then six in our PGY, three in our PGY2 class. I want to say that we have five in our upcoming class, the class that just matched this year. And so we kind of alternate between five and six residents per year. We have a total of 24 faculty members, and that includes like our medical dermatology faculty members, as well as our dermatopathologists, our Mohs surgeons, our peds derm, and some of our research derm people as well. So have a pretty good group of people here. And yeah,
Cool. Okay. Does UAB have a medical school, and is it, or does the University of Alabama in general, is it in Birmingham? Are you guys close by to them?
yes, so it's actually literally right down the street from our clinical sites. It's the UAB Hearsing School of Medicine. It is actually where I completed my medical training. So we're really lucky to have the medical school here nearby. We're able to go teach there, teach at their dermatology week, engage with some of their like community service projects, and then also just getting to interact with students, bringing them onto research projects. And so I think we're really lucky that we do have that partnership readily available.
Awesome. Okay, let's talk a little bit about fellowships. We'll start with fellowships after residency. Does UAB have any fellowships at all?
Yes, so we do offer a MOS fellowship with training under our two MOS fellows, or sorry, two MOS attendings. It's one MOS fellow a year. So they train with Dr. Wong and Dr. Bergman. And then we also have a dermatopathology fellowship. They actually have two derm path fellows a year, and they train with Dr. Pavladecki and Dr. Alston.
Oh, okay. And let's talk about research fellowships now. Are there any faculty members at UAB that run a research year or research fellowship for medical students? And if so, how many students do they usually take?
So, we don't actually have a research fellowship designed for medical students. However, we do have a research fellowship designed for postgraduates. And so, this is a 2 year clinical research fellowship. We accept one fellow a year. Dr. Tiffany Mayo is a strong attending, kind of leading the charge for this clinical research fellowship. We do historically match our research fellows, but it is a requirement that you have completed or are planning to complete your PGY1 intern year
Okay.
before starting the fellowship. Yeah.
Okay. Got it. Okay. Speaking of research years, how does UAB view students who did a research year or who got a PhD? I know you pretty much know the people, in your class and in the cohorts above you, but did they do a research year or get a PhD? What does the landscape look like there?
Yes. So we do historically match our research fellow. And I think otherwise, we really see like research years and PhDs very positively. UAB really values research, and I think we really value that with research, we can contribute to the progress of the field of dermatology. So I would definitely say very positively. And then I think like going back, I know I mentioned like the research fellowship for postgraduate, but I think too, like we've had opportunities here for like a more informal research fellowship for medical students. So I just wanted to mention that too. It's just not as like um, what's like a structured as our clinical research fellowship for postgraduates.
Okay. All right. And then as we're talking about kind of admissions and stuff, do you know if your institution has historically accepted any DO or IMG students? It's okay if you don't, because you just started there, but if you know of any history.
Yeah, so UAB consistently does like a holistic review of all applicants. But I do know that historically, at least in the past 5 years, UAB has not matched a DO or IMG.
Okay. All right, we'll get into training now. So tell us just kind of bird's eye view, the structure of the program. Is it on a block schedule or a longitudinal schedule or something else? How much elective time do you get? We'll start there.
So we're mainly kind of like on a block schedule. We have just depending on first, second, or third year of derm, our medical derm blocks are kind of staggered a little bit differently. I can break it down if we have time. I
Yes.
actually pulled up a little sheet. So, like in our first year of derm, so PGY2, we get 8 months of medical derm, 2 months of derm path, 1 month of peds derm, and 1 month of surgery. In our second year of derm, so PGY3, we get 6 months of med derm, 2 months of derm path, one of peds derm, one surgery, and two consults. And actually, during our second year of derm, we do have the chance to do an elective month. And then in our last year of residency, so third year derm, PGY4, we get 3 months of med derm, 2 months derm path, 2 months peds derm, 2 months surgery, 1 month cosmetics, and then again, the chance to get to do an elective month.
Wow. Okay. Very helpful. Very well spread out across all the years, and you get, increasing exposure in certain things as you go.
Yeah.
And you talked about the elective experience as well. Do you guys spend time at all on other services like plastics or medicine or anything like that?
So we don't necessarily spend time on other services. We do have some collaborative combined clinics with other services. So we do collaborate with infectious disease doctors. We have our UAB has a 1917 clinic for treating patients living with HIV. And so we do have one of our dermatologists who's interested in more like complex medical dermatology who will go collaborate with them. We also have collaboration with pediatrics at our PCOS clinic. And then we also collaborate with rheumatology in our rheum derm clinic so that we may not be completely put on a different service. We do collaborate.
Cool. Okay. I love all the collaborations. That's great.
Yeah.
Okay, so tell us now a little bit about each clinical site. Do you guys have a VA or a county? Questions like that. And, what do your sites look like? Are they in a hospital, private practice? So tell us a little bit about that.
Yes. So we have our Whitaker Clinic. That is like our home base. It is situated right in downtown Birmingham. It's pretty well like modernized clinic space, ample room to like hold multiple attending clinics, as well as our dermatology urgent clinic. So that's kind of where we spend the most of our time. Right down the street is our UAB main hospital. And so that's kind of where we're at, as well as our like women and children's hospital when we're on consults. We also spend time at the Children's of Alabama, and everything within like all of these hospitals I'm mentioning are all within walking distance. And we actually have like those walking sky bridges. So you can walk from our Whitaker clinic to the main hospital to Children's, all while staying inside. Um, we're also at the VA and at our Cooper Green Hospital. Although those aren't connected by sky bridges, they are quite literally across the street from either our main hospital, is where our VA is, where we get to serve our veterans. And then right next to our children's hospital is our county hospital called Cooper Green Hospital. There we serve like patients that live in the greater Birmingham area in our Jefferson County. And they're actually building a new building. So we're hoping to move into that clinical space, I think within the next 6 months. So that's been really exciting.
Cool. So you mentioned about, by the way, I love the sky bridges, very fancy.
Yes,
We love a good
yes.
sky bridge. You mentioned
You
about
are
the,
always, like, yeah,
it's
always well protected from the weather, the heat, the rain. So that's nice.
That's perfect. Tell us a little bit more about the pediatrics because I heard you mention something about a PCOS clinic earlier and then also the children's hospital. So tell us where you're getting your pediatrics exposure.
Yes, so we are getting our pediatrics exposure with Dr. Ravi, and we'll be actually adding on another peds derm attending next year. So we're excited about that. Our clinic is in the Children's of Alabama. They have like an outpatient section located right here in downtown Birmingham. The PCOS clinic is more of a specialty clinic that also occurs in the Children's Hospital. But usually we are working more with Dr. Ravi in our just regular peds derm clinic. He is actually the only peds derm, I believe, in the state that is like peds fellowship trained, um, like peds derm fellowship trained. So we're very lucky to have him here, and we get referrals from all over the state.
Awesome. Um, Before we go into a little bit more about your program, do you have sites that are far away at all? Do people have to use transportation to get anywhere? Because you talked about everything kind of being walking distance with the sky bridges, but any sites that you have to drive to?
We do have one site, but it is part of our specialized rural residency track. This track is tentatively occurring every 3 years. So the next one would be for March of 2026. That clinical side's about an hour and a half away with the rural resident rotating there for 1 month each year. But there is a housing stipend that is allocated for that month. But otherwise, um, we're all pretty much right here in downtown Birmingham, all pretty walking distance.
Nice. That's really a blessing to be able to have
Yes,
walking distance. It's so nice.
that's
Okay, so the age-old question that's always asked of every program, and it's very personalized
yeah.
to who you ask, but tell us just from your experience how you feel the strengths of the program are, or what you feel the strengths of the program are, and then areas that the program is making improvements in.
Yeah, so I think with strengths for UAB, we are definitely a strong academic program. I think number one strength, I feel like we get a very well rounded education with a very like solid general derm foundation, but also ample exposure to all of the specialties, which I think is just like really important. I love that at UAB we get to treat a diverse patient population, both at like our Whitaker clinic, but also at the VA, at our county hospital, Cooper Green, as well as our children's. We serve the greater Birmingham area, but we really serve, the majority of the state of Alabama, as well as some of the surrounding states. We have patients driving in from Mississippi, Tennessee, or even Florida. So with getting to see diverse patient populations, we are getting to see diverse pathology as well. I think another strong suit too is that we really get the honor to learn from like world renowned, really respected, and experienced and kind dermatologists. I feel very lucky that we get to learn from them and that we have them here with us in Birmingham. I think you asked too about like improvements within the program. So I think something that's been really nice is, I went to medical school here, I rotated here. And now 2 years later, I am in my first year of derm here. And even in the last couple years, I can tell that there have been new changes to the program, which I think is nice. I think something that's new is that we have a didactic half day to kind of get like more hands-on experience. So that occurs like one Monday each month. So far, we've done like a cadaver lab, like half day to practice our excisions. And then the upper levels kind of got to practice more complicated Mohs, flaps, and techniques. We also had like a cosmetic Botox half day. I know in the past they did like a kind of a wellness half day and they looked at the intersection of art and medicine and they went to the Birmingham Art Museum. So I think that's been a fun change. I think something about our program is that leadership is really responsive and is pretty quick about like making effective changes based on resident feedback.
That's great. That's always great to hear, that, everyone is receptive and willing to learn and improve for the residents. So, all right, let's go into surgery experience for a second. Tell us about surgery experience. Does it happen mainly in that Whitaker clinic or at the VA or county? How soon are you actually helping with the operations as a resident?
Yes. So during our first year, we do get that dedicated month of surgery that does occur at our Whitaker clinic with Dr. Wong and Dr. Bergman. And then we get those 2 months during PGY3 and PGY4 year. But we also do get surgical experience at our VA, typically Wednesday or Friday afternoons. Are our surgery days where either our Mohs surgeons or our Mohs fellow or one of the community Mohs doctors will come over to the VA and help us practice there. So I would say as a first year, like our first exposure to surgery is either at the VA or during our surgery month. I think they kind of have us a little bit staggered towards halfway through just so we can get kind of our footing in clinic first, the first like 6-ish months. But yes, so um, we definitely still get to do procedures during our first year.
Okay, great to hear. A lot of people want to know about cosmetics. So, how much training do you get? Is it part of your curriculum? Is it something that residents have to seek out on their own, or it's something that is like after hours? Tell us a little bit more about the cosmetics training.
Yeah, so we have our dedicated cosmetics month during our last year of dermatology, but we definitely have like hands-on cosmetics practice throughout the rest of the dermatology years. Like I mentioned earlier, we have that academic half day. We recently did a cosmetic Botox practice. I think too, we kind of get to practice what we learn in attending clinics as well as in our own continuity clinic. And so we kind of have like more trainings kind of sprinkled throughout. And then we have that dedicated month. And then if you're interested, you could also spend your elective month in private practice with somebody doing cosmetics if that's something you're interested in.
Okay, great. Tell us about if your program has a continuity clinic, when that starts, and how often you're able to see your own patients.
Yeah, so continuity clinic starts literally for us. It was day one. I think my first day in clinic. My it's a half day a week. So it's consistently, one afternoon or one morning each week. So mine's like Wednesday afternoons every Wednesday for the rest of this year. Is my continuity clinic. So that's been really fun. We get to practice billing in that clinic, which I think is really helpful. Just kind of sets us up for practice for the real world. And we get to follow these patients over the long term. And we also have like our dermatology urgent clinic where we see patients that need to be seen more urgently. And if we find that these patients have more chronic conditions, then we can kind of follow them up in our continuity clinic as well. So we do have some autonomy in scheduling those patients as well.
Okay. Is the urgent care like 8 to 5 every day? Is it open on the weekends? How does that work?
No, so it is specific days. So it's actually Monday morning, Tuesday afternoon, and Friday afternoon. We call it DUC for short, Dermatology Urgent Clinic. Typically, we schedule 50 to 60 patients for that afternoon or that morning. And we have multiple residents really tackling multiple attendings. It's really kind of meant for, spot checks, things that are urgent. Um, and it's been really helpful for our patients, especially since some of our attending clinics have a little bit of a longer wait. And so this allows for us to see patients sooner and more effectively, and also gives us a chance to kind of see some good pathology too, because you really never know what's going to walk in during death.
Yeah, that's very exciting. Like, kind of
Yeah.
feels like a mini ER just for derm. So,
Yes, exactly. Yeah.
very fun. Can you tell us about any global health opportunities associated with the program, or if you know of anyone who's involved in that?
Yeah, I don't think that we have like a pre-designed global health program, but I think if that's something you're interested, you could definitely use your elective time to set that up. I think UAB definitely, as a main institution, definitely has connections internationally. So I definitely think that that would be a possibility if that's what you're wanting to set up.
Cool. All right. Yeah, that's honestly the great part of being part of a huge institution is there's like an undergrad campus and a med school campus. So there's always someone you can rely on to help you with
Yeah.
your things. Last few questions within the training section, and then we'll
Mhm.
go into research. How much autonomy do you guys have as residents? How does that work throughout the course of the few years there?
I think we definitely have like graduated autonomy over the years with adequate supervision. I think, like I mentioned, we start our continuity clinic quite literally day one. And so I think that gives us a lot of autonomy from the get go. But of course, especially as we're first starting out, I know for myself, I know that I'm still learning, and so still relying on my attendings here and there, and very, very thankful to have them and have their guidance. But I can definitely see, the third years um, feel really confident, and their presentations are much shorter. And even when their attending goes into the room, it's just a quick little pop in because they're just more confident. And so that's kind of nice to see too, that we kind of gain more autonomy as we go through the years.
Okay. It'll be exciting to see yourself kind of go through that too and be like, wow, look at
I
how far I've come
know.
after a year or two.
Hopefully. Yeah, fingers crossed.
Yeah. Last question in this section is how does call and consult service work? How often is it? I'm sure it's not as often as other programs since you guys have so many residents, but tell us how often you're taking call or doing consults.
Yes, so consult months are reserved for PGY 3 and 4 residents. So during our first year of dermatology, we do not have a dedicated consult month. But we do start call during our first year of dermatology, and it's actually buddy call. So the way that consults work, so we have the consult resident on for a month, and they accept consults from 8 a.m. to 5 p.m. Monday through Friday. So they're, chart checking in the morning, rounding on the patients individually, evaluating, seeing if they'll need a biopsy, and then after, in the afternoon, running the list with our attending Dr. Elston is our main inpatient consult attending. And she and the resident will go and round on the patient in the afternoon. For on call residents, that starts from 5 p.m. to 8 a.m. Monday through Friday, as well as weekend. And so, kind of yielding in consults, home call. We start in the fall of our first year. And for I would say the first like 6 to 8 months, it is a buddy call with a third year derm resident. So I think that's really nice. We're not completely on our own for on call. And like you were saying, we kind of split it up between the number of residents. So there's 6 of us in my class. So we just kind of worked out when people were going to be on vacation or holidays and just split it up equally for the rest of the year.
Okay, that's the buddy call is very nice. So you kind of ease into it.
Yes.
Okay, so a few questions about research. Tell us first what the research requirements are for you as a resident.
Yes. So we're definitely always encouraged to submit interesting case reports to more local and national meetings, including like our Alabama Derm Society meeting, as well as the AAD meeting. We do have a QI project that we're encouraged to do each year. I think that's pretty standard across dermatology programs. But I think with research, we have a lot of opportunities here at UAB with both a very like robust basic science research program, as well as with our clinical trials research. And so if that's something that you're interested in as a resident, that's definitely available as research opportunity as well.
Okay. So you said there's a lot of opportunities for research, like individual cases, and since you guys are a big institution too, lots of clinical trials happening. Um, is it something that you as a resident can seek out and you're like, I'm interested in this project. I know this attending likes doing this and I'm going to follow through? Or are there certain projects that are given to you by leadership?
I would say it's definitely more kind of resident led, just seeing if there is a certain area that you're interested in and kind of really proposing a project. We can definitely, we definitely have like resources to help support us for IRB approval and kind of getting that ball rolling. Um, and occasionally there are like interesting case reports or case studies that we want to look at more closely. And so those might fall more easily if we see those in clinic. But it kind of varies, I guess I would say.
Okay. And then tell us a little bit about the financial incentives or perks that you guys get. So, do they pay for you to publish or to go present at a conference? What does the funding look like?
Yes, so we get 2,000 a year for conference funding. So that's for applying to the meeting and housing and travel. Um, and so I think that that's a very generous, and they do try to make sure that all of our first year derms, all the skin turns, get to go to AAD. So that's also a nice perk.
It's always fun going to AAD, and especially
Yes.
I bet as a new Durham resident, it's even more fun to
Yeah.
go to AAD. So it's nice that they prioritize that for you guys.
Yes, I'm
So
excited.
going into exam prep and didactics, you talked about a half day of didactics earlier. Is that the only time didactics happen, or do they happen mornings and evening times? Tell us about the layout of them.
Yes. So the half day didactic is one Monday each month. So that one happens a little bit more sparingly. Otherwise, we have didactics every day from 7:15 to 8:15 a.m. We did 7:15 because that kind of allows time for those with kids to drop off at daycare or have the nanny come in or um, what have you. And so we start at 7:15. We have a pretty structured week to week. So Monday is Derm Path Unknowns with Dr. Elston. So we're sitting at the microscope, kind of just reviewing slides. Tuesdays are typically Kodachrome, so looking at just different images, trying to give a description of the morphology as well as a differential. Wednesdays are rotating faculty lectures. Thursday are our Derm Path textbook lectures. So going over like a specific chapter and going over unknowns for that chapter. And then Fridays are our textbook chapters. So this year we're currently going over Bologna. And then next year, I believe we go over Andrews and Wolverton. So we kind of alternate so that we get some good exposure to some of the different textbooks. I think other that's our main didactics. On Tuesdays at noon, we do have our grand rounds, and I think it's every Tuesday, every second Tuesday of the month is our journal club. And so, other than Tuesdays, the rest of the week is usually just free for lunch and finishing up in clinic and getting ready for afternoon clinic.
Cool. I love the organization. Like Mondays
Yeah.
is Dream Path, Tuesday is Kodachromes. Like it keeps a good routine for you guys too.
Yes,
Um,
know exactly what to expect every morning, which is great. And it's nice too to kind of get it out of the way each morning, just woke up, bright eyed and bushy tailed, ready to learn. So I'm not a morning person, but I've actually enjoyed just having that structure every day.
yeah, yeah, the structure is very nice. Do you have any protected admin time, like a half day up to study or do research at all?
Yes. So during our first year of derm, we get one academic half day. Like you were saying, it's good time to study, to do callbacks, to catch up kind of on our inbox or do any research. During our second and third years of derm, we actually get two half days a week.
Okay, awesome. So going into program leadership, tell us about who your program director is, who your chair is, any other important leaders we should know at UAB.
Yes, so our chair of dermatology here is Dr. Bonnie Aluski. Our program director is Dr. Lauren Cole, and our assistant program director, and she's also the medical student director, is Dr. Carly Elston.
Okay. I'm going to skip the next question. Next question was if they're responsive to feedback, but we already know they are from what you had previously said. So tell us about what role you guys as residents, I know you just started, but if you know, what role do residents play in the interview and the match process?
Oh, yes. Okay. So we do have one of our PGY2s, so our first year derm residents participate in the actual interview day. So they're sitting in the interview with the medical students or the applicants. And then some of our other residents would also be available for like the pre-interview dinner as well as for Q&A sessions on the interview day. And then all of our residents do have input in the interview process at the end of the day.
Okay. All right. Going into the fun topic, which is resident life. So, kind of how life is in Birmingham. So, let's start off with the personalities and the interests of the residents there. What do you guys like to do? What are the personalities like? Tell us just what the vibe is like at your residency.
Yeah, I think currently we have like a very sweet, mellow group. We're big foodies. We have been going to get dinner like pretty consistently, like Fridays after clinic. Just trying new restaurants in Birmingham or trying Birmingham favorites. We haven't quite started this back up yet, but I know they used to have Wimbledon Wednesdays where they'd go play tennis after clinic on Wednesdays. So a little bit of a sporty group too. I think it's been so hot this summer that we'll try to pick it up once it cools down a little bit. But I think, with Birmingham, we're a small downtown, but we do have some fun food spots. So we do end up revolve around hanging out around food, which is fun too.
Yeah, I'm from Texas, obviously Texas A&M, and
Yeah,
Texas, Houston has great food, Austin has great food. So honestly, I don't complain my weekends being full of food. So
exactly.
I love that. Okay, so tell us about living situations. Do most people rent or own their living space? And since everything is really close to that one med center, do most people live around there or kind of throughout Birmingham?
Yeah, I think it's definitely variable to kind of like what stage of life you're in. So I am currently renting. I live right downtown. I walk to clinic every day. I'm literally like a block and a half away from Whitaker Clinic, so that's really convenient. I would say there are a couple other residents that live within walking distance. And then I'd say the rest either own or rent kind of like townhomes or houses, maybe a little bit farther out. I think it kind of depends on your wants and needs. I know one of our residents lives a little bit farther away, but they have a nice house and a yard for their dogs. And so I think with Birmingham, there's a little bit of everything where you can be right downtown, closer to the action, live in an apartment, or you can still be like 20, 25 minutes house in an apartment or in a house and still make it into clinic pretty easily. Traffic is not too bad in Birmingham.
Okay. Walking to clinic is honestly very nice. That's the dream. Fresh air in the morning. That's great.
It's been so nice. It's a little perk to my morning every day, which is nice.
Yeah. So tell us about the cost of living. I know you're not a real estate agent or anything, but what would you say is the average rental price if someone's looking for a one bedroom apartment, kind of like near the area that the medical center is in? What would that be? And generally, what is the cost of living like in Birmingham?
Yes, I would definitely say like closer to downtown is definitely more expensive. I think like a two-bedroom usually goes for like maybe 2,000 and a one bedroom might be like 1,300 to 1,600 right downtown. But I would say like the little bit that you go farther out, you can definitely get under $1,000 a month. So it's definitely variable. I think as far as like buying in real estate, the market's been a little bit chaotic, and so I think it's kind of been waxing and waning. So those prices have been going up and down, just depending what suburbs you're looking at. But definitely lots of different options, and I feel like even the higher end for the downtown is not too bad and fits well with our salary.
Yeah. Do you guys get a housing stipend at all?
We don't.
Okay. All right. So we know everything, all the clinical sites are kind of near each other, but is it necessary to have a car in Birmingham, or is there very good public transportation? Can people get by without a car?
I think we do not have the best public transportation system. So I think just for the purpose of living in Birmingham, yes, would need a car. If you really wanted to stretch it, I could technically walk to clinic every day, not use my car at all. I could technically walk to a Publix, a grocery store, and come back home. But I think for being able to enjoy Birmingham, would need a car to get around.
Okay. What is the resident breakdown of being single, married, having kids? Is there a mix within your program?
I would definitely say it's like very mixed. We have people that are single, those that are in relationships or married. And then we have a couple people with kids too, which is fun. Some of my co-residents have, I think we have four babies like under two or five babies under two. And so kind of fun that we'll get to see them grow up over the next couple of years.
Oh, that's so exciting. Maybe future UAB Durham residents.
Exactly. Getting started very young.
Yes, get them started early. How does your program support having children? So if, one of these individuals or one of these residents wanted to have a child, how does the maternity or paternity leave look like?
Yes, I know that UAB Durham is very supportive when it comes to maternity, paternity leave. I don't know if any of our current residents have had to take leave, but I know that in years past, um, it was not an issue at all. As far as like the breakdown, I think I wrote it down because I did not know this because I have not had to utilize this. But I think with FMLA, you can get up to 12 weeks off with using 4 weeks parental leave, sick, 6 weeks of sick days and vacation, and then 2 weeks unpaid. Is I think how you can break it down. So I definitely think good support there if that's something that is in your future.
Okay. Just to wrap up this resident life section, we've talked about food and Wimbledon Wednesdays and everything. Do you have anything else about Birmingham we should know? Things that people like to do there? Are there any areas that you can drive nearby to, like parks? Or I've never been to Birmingham, so I don't know what the feel is like, but any concluding thoughts about living there?
Yeah, so I'm an Alabama girly. I am biased, but I truly think like Birmingham is a hidden gem of the South. We have a small, quaint downtown, but we have fun food places. We have fun cocktail bars. We have good parks nearby, like small parks that you can just go walk, or you can go also drive a little bit farther out if you're more into kind of a light hiking. There's also, Birmingham's a smaller city, but we're in short driving distances to Nashville and Atlanta if you kind of crave that bigger city feel. But we definitely don't have to worry too much about traffic in Birmingham. And something nice too is like Alabama is just really beautiful. We have like beautiful rolling hills. We have lots of lakes in our state, and we are a short drive from the Alabama coastline as well as from the Florida panhandle. So I find myself often, going to the lake or going to the beach. So um, love Birmingham. It's a small place, but it's a good place. So highly
Awesome.
recommend.
Yeah, well, it's great that we chose you for the podcast because it's great, you know more about Birmingham than just a resident who just started there. So, good to hear that it's a fun city to live in.
So I know I'm like a true Alabama girl, but I did want to mention that we do have residents, though we have some that are like from Birmingham or went to school in Birmingham or undergrad. We do have residents from California, from Florida, from the Midwest. And so we definitely have like residents from diverse places that have all kind of come together and now we're here. So just wanted to touch on that too.
That's great to hear, honestly, the geographic connections, and where people are coming from. So, just a few final concluding questions. Tell us where applicants can learn more about you, the program, of course. So, do you guys have an Instagram, a good website, or anywhere else that we should find you guys?
Yes, so we do have a website. I think the best way to find it, honestly, is like Googling UAB Dermatology Residency. It kind of gives a breakdown of our curriculum, of what Birmingham has to offer, as well as kind of like our application process. We do have an Instagram. It's at UAB Dermatology. And then if you still had questions after looking at the website or looking at the Instagram, we do have an email that applicants can reach out to, and that's dermatology at uabmc.edu.
Okay, awesome. Last two questions are kind of your personal journeys advice. So, from your experience, what advice could you give medical students watching this today that are interested in dermatology?
Yeah, so I saw this question. I think I have like a simple and a thorough answer to it. I think simple answer just being mentorship, but my more thorough answer is mentorship at all levels. So mentorship with attendings, with residents, as well as peer mentorship, and really not being afraid to be direct and honest and vulnerable when approaching these relationships and discussions with your mentor. So, like, more specifically, like with your attending mentor, really sitting down and like figuring out your game plan to applying dermatology, with also backup plans. I think dermatology is competitive, and it's always important to be thinking a step ahead of, I'm applying derm, but am I, what prelims am I going to look at? Or am I going to consider a research year? Or am I going to consider dual applying, or kind of looking at like steps ahead and really reaching out to your attending for that guidance? I think attendings can be good too for like insights on other programs, and then also just general insight into the application process. I know Eris is always has something new and fun they like to throw out each year. So kind of how programs are like perceiving those changes. I think for like looking for your resident mentors, like really asking them about their experiences and applying through kind of what they've learned, as well as like their experiences maybe at their home program or other programs. And then really asking about like prelim, TYs. I think just knowing about what your residents have already gone through can give you a lot of insight. And then just lastly, like your peer mentors, even if it's like a medical student a year ahead of you, or even somebody that's applying with you, I think there can be a lot of nuance to the dermatology application. So being able to like lean on somebody that is going through the same process as you can be really valuable. And I think, some of your peers that are applying with you in dermatology could be seen as competitors. But in reality, like they're your future colleagues and your future co residents and like your future dermatologists. And so I think it can be really important in like supporting and uplifting each other. And so, you know, short answer mentorship at all levels. Um, but just don't be afraid to like pick people's brains, and I wouldn't be here without those that like supported me. And so I think it's definitely important not to go through this process by yourself.
Okay, love that. Final question, which is still also advice from you, but what advice do you have for medical students in choosing a residency program?
Yes, so I think choosing a residency program is like a very individualized process, but really looking at like different core categories and seeing what you prioritize. So I think really looking at what each program has to offer in terms of curriculum, in terms of exposure to the subspecialties. If you're interested in a subspecialty, looking at their fellowship opportunities in their fellowship match rate. Have they matched residents recently into that fellowship? I think taking into account the number of residents, as well as even location and if you'll have family or support nearby. I think at the end of the day, like choosing a program is like very individualized to you as the applicant, but um, you do want to be able to choose somewhere where you'll receive, well-rounded training so you can be the best dermatologist for your future patients.
Okay, great. Well, this was very exciting. Thank you for teaching us about University of Alabama at Birmingham. I guess I have one other question. Are you guys the only residency program for dermatology in Alabama?
Yes, we are.
Okay, that's what I thought. So we got the golden ticket, the one residency
Yes,
program in Alabama. We know you're a very busy resident, so thank you for taking the time to spend about an hour with us and tell us about your program. Thank you,
thank you
everyone, for
for
tuning.
organizing this. This is a great idea, and I'm happy to share. So thank you.
Yeah, of course. All right, we'll see you guys next time.